that day one a person is not so. There are various circumstances and there is adaptation due to which the person reacts, because each and every person has to survive in the environment, isn't it? So it depends upon the environment. The environment is the person with whom the patient is acquainted with. So it could be at the family level, it could be at the office level, it could be at the job level, isn't it? So we will understand this through a case. So herewith I begin. So this is the case of a 51-year-old female, and she was suffering from neck muscular spasm. And you have to mark this, that it was on the left hand side. Okay, so left side, the muscular spasm, the neck area basically. So it was affected. And why left side is affected, I will tell you in the subsequent, as the session goes, you will understand that. Okay, and basically she was even suffering from migraine. So migraine also left side. Again, you have to underline left side. Okay, so now why left sided I'm asking you all and I'm emphasizing is because whenever it is loved ones, okay, blood related, the left side is the one which is affected. Okay, so as the case got unfolded and she was giving her case history, so migraine left-sided, sun aggravation, and she would get that aura, vomiting as well, and left-sided hand was, there was tremendous pain, especially when driving. No, she was driving and she has this muscular pain, and it was since 15 days all these complaints started. Then this female, she is with, if we got to see the IPR, she stays with her uh, two sons, and son, the elder one is married, and so the daughter-in-law, and the younger son is studying in 8th standard. Okay, so, and she has got one daughter who stays in States. Now it so happened that her sister was also staying in States, and she just recently she died. And this lady is very sympathetic, very pessimistic as well. Okay, so whenever the kids would go out, she would get that negative thoughts. अरे कुछ हो जाएगा तो. Okay, and this female, she would always not allow her kids to even go out and play. नहीं, बच्चे को जो है दूसरी जो है बुरी आदत लग जाएगी तो वो लत लग जाएगा, तो इसके लिए जो है वो हमेशा अपने बच्चों को घर में ही रखना प्रिफर करते थे, क्योंकि उनकी जो सोसाइटी थी ना, तो वहां पे जो है देयर वर मेनी वुंड्स नियर बाय टू दैट सोसाइटी, तो शी वाज अफ्रेड कि व्हाट मेरे बेटे को भी ऐसे कोई आदत लग जाए करके. ठीक है, अब उनकी जो सिस्टर उधर रहती थी तो उनको लिवर का कंप्लेन हुआ, एंड देन शी डाइड ऑफ liver complaint, and this lady was grieving. Okay, and she used to get dreams also of her sister. So it so happened that just past 2 days she got the dreams, and she was in much agony, so she thought of visiting the physician. Okay, then when she came here with, she said, I am very much concerned about the welfare of my kids. I always constantly worry. Okay, so it so happens that even at night she is like sleepless and constant worry चलता है उनके mind में कि my kids should be safe and nothing should go wrong. She being the eldest daughter-in-law, she would take all the responsibilities of the house. And there was a bit controversy with the mother-in-law. So the basic thing, if you got to see the crux of this case, it is that the sister whom she was very much attached to, she would share her feelings as well. And for that, she would then feel so bad, and she was literally grieving that my sister is no more. She died of liver complaints. Okay, and by profession she was a teacher, but then it so happened that after her delivery, she left that job, and then since it was a joint family, she had to stay with 12 sister-in-laws as well. So it so happened there was no support. Okay. So then she did this Mehndi beautician course, and with this, she was like constantly in to the family background was such that they wouldn't support her. जो भी करना है घर पे रह के आप करना. Earlier she would go teacher का करते थे, लेकिन then after delivery they said कि no, it's you stay at home and you can do. Okay, so this is the basic thing, and she had that constant weeping tendency, weeping disposition, and when she was giving case, that time also there was tear film in the eyes, but it didn't roll down the cheeks. Okay, so she had this, and she is very sympathetic. और कोई भी मतलब ऐसे किसी को भी तकलीफ में वो देख नहीं सकते हैं, और किधर अन्याय भी होगा तो वो जो है उसके खिलाफ आवाज उठाएंगे. ठीक है, इनजस्टिस कैन नॉट सपोर्ट. So this is the basic crux, the case. No doubt it was a longer one, but this is the gist of it. Okay. And it so happens that her daughter was studying for MCA. Okay, in States. And in States, there is this kind of, she said, I'm just depicting what she said, and it's the same verbatim, the same transcript which she described. Okay. So it was like lottery system होता है वहां पे. तो मुझे यही फिक्र थी कि मेरी बेटी को MCA में एडमिशन मिलेगा कि नहीं. This was her basic concern. So the whole case revolves around grief, and it even revolves around her care for others. Okay. So when she is very much angry and when she is aggressive, then it is like contradiction aggravates. The anger, contradiction aggravates. So when we sum up everything, I analyzed and I could pick up these rubrics, that is grief, silent grief, anger, contradiction from, case full of day and night, fear climbing boys would be harmed. Now, this fear climbing boys would be harmed. How do we understand it in this case? So it is basically that this female feels that मेरे बच्चे जो है बाहर जाएंगे तो उनको जो है खराब संगत लगेगी, और उस खराब संगत के वजह से मेरे बच्चे जो है वो बिगड़ने नहीं चाहिए. That is the basic thing which is going at the back of the mind of this female. Okay, so that's the reason why I took this rubric. Actually, I wanted to emphasize on this rubric through this case because we have heard it, but the practical implementation along with the replicability holds true in each and every case. Okay, then injustice cannot support. Then pessimistic. Pessimistic is a negative attitude. So I say an example, like a glass is filled with water. Okay, half full. Okay, but the optimistic one will say at least half जो है full है, but pessimistic जो है will see that आधा तो खाली है ना. So why you are seeing the negative side? You got to see the positive ones. But these people being so very much caring. See, Causticum belongs to the fourth row. They are bound to family, bound to this house. Okay, so they are basically insecure ones. The fourth of the periodic table. Okay, so I took pessimistic rubric, and she is very sentimental because of her weeping disposition. She would weep. Okay, so this was the basic case. Causticum 200 single dose was given to the female, followed by Saclac, and she was asked to report me after a week. After a week, she was very fine and she did not require second dose because as it is, Causticum is a deep acting remedy. Okay, so she was all fine and she was all praises for homeopathy as well. And she said it has definitely given me a lot of relief. And then I continued for Saclac placebo just to see that there shouldn't be any relapse, but she was very fine and just one dose and still she is on Saclac. Okay, so and one more gist I want to share of a stalwart book. There was a case where a grandmother, she was babysitting the infant, and it so happened that unexpectedly and suddenly that baby died in her arms. And To add on to it, the daughter-in-law even accused her that because of you the infant died. So that female, she was grieving. And I have marked few points also. The Causticum reacts actively out of sense of injustice. They organize boycott